All right.
Okay. So this place was reception,
Okay.
and once either patient comes, there used to be a receptionist, a nurse, receiving the patient, the new patient and visitors here.
Okay.
And then that was in doctor's office also. Yeah, this is doctor's office.
Okay.
And then that hall over there, that was a very long ward, very big hall inside there, like when you see the windows,
Okay.
uh, staffed with beds and other facilities. I mean, I remember those days, doctors and nurses used to do when they want to sterilize their syringes. You know, they used to have stoves,
Oh, okay.
stove
Okay.
and pot to burn their syringe inside there.
Okay.
And we, as kids that time, we used to come stay with them, you know, play with them. Back in 90s, I mean, 90 something, 95 and so, this place was well functional, but just don't know what happened along the line, and
But
everything scattered.
what has the community done about it?
Well, I think that is what the village head might want to look into. They have made effort, from what I understand, they've made effort to reach the government or to get the government attention. But so far, nothing really happens. Nothing happens.
Okay. So what has been the impact of the collapse of this primary health center in the community?
A lot. So everybody now depends on chemists. You know, this chemist now. Anybody gets sick, and you just have to go to the chemist because there is no hospital where you can see hospital here. Is at the Ikorobasi. That is the closest you can see at the Ikorobasi. And before somebody can, before you could get there, like I told you earlier, of the camera that my mom died 2 years ago because of little stuff like this was not present in the community. Before she could be rushed to Ikorobasi, she passed on the way, followed by my elder brother, and then my sister also. So I mean, this happened in the span of 1 year.
Okay.
Span of 1 year.
Or would they see? Could they have been? Could they have been maybe treated or rescued if the hospital was working?
Definitely, my mom had sugar. She had a high sugar, and I mean, high sugar is something that is manageable.
Yeah.
You know, she was managing it, but on that very day that we have the crisis, she couldn't. She succumbed to it because there was no doctors present. I took her to Uyo anyway. She was in Uyo. I took her to Premier Medical Center in Uyo, and she was treated there, and she spent almost a month plus in Uyo. And when she was discharged to return home, then she had a crisis 2 weeks later. So that crisis, nobody to manage it, no doctor, no nurses to manage it. She was rushed back to Ikorobasi, which is the nearest hospital, and she passed.
It's a pathetic situation.
She passed.
So what did you say happened to this? Here used to be.
This was a football field, the hospital football field. All of this land is the hospital land. The nurses and doctors used to come on this land. So the very good football field. We used to come here to play football in those days. But look at Kasafa now everywhere. This was a very a good football field with the borehole behind the health center. All of that is the health center's farmland. I think the community has taken over now to plant because since there is no government present here,
Yes.
so they take it to plant cassava.